Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you will have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers! Today it's a revisit of one of our Facebook Lives with Anae Lloyd and Tanya Grantham. They talk about puppy bone growth and development, specifically bone growth from 6 days to 22 months, and how activity levels, exercise impacts on that bone development, and so much more. Vet rehabbers joined them from all over the world to ask questions and to get in on the conversation. So if you're on Facebook, please come and join us in our online communities. We have the small animal vet rehabbers, hydro vet rehabbers, equine vet rehabbers, and our business vet rehabbers. And this is where the vet rehabbers hang out online. They share research, tips, and advice, and it really is a great supportive community. We'd love to have you online there with us. A quick word from our amazing sponsor, Curicor Vet. Curicor is owned by Nada Robinson. Nada first developed her courses at the Colorado State University, and where she started the medical acupuncture for veterinarian certificate program. And this was way back in 1998. She developed a science-based platform for veterinary acupuncture, which was the first of its kind. And today, Curicor Vet offers a comprehensive curriculum in integrative medicine with a rational, evidence-supported foundation. The courses that they have are medical acupuncture, photomedicine, botanical medicine, medical massage, and integrative rehabilitation. You can discover Curicor Vet at curicor.org, and you can also see them at this year's Vet Rehab Summit, which is on the 31st of August, 2024. So more from Tanya and Anae.
Hi and welcome. Hi Tanya, thank you for joining me.
Hello Anae. Hello everyone who's coming online.
Today, Dr. Tanya and I are chatting about puppy bone growth and development. So I think this is really interesting. Every now and then we have these images circulating the internet or social media, I should say, that show these puppy growth plate or the puppy bone development at very, very young ages. Lots of interesting information comes out whenever they circulate. And so I'm really excited to be able to have this conversation and dive into what we're actually looking at. And maybe we can go into some other areas of bone growth and development and what we should and shouldn't be doing with our puppies as well, because that's all a part of the conversation. Dr. Tanya, will you please introduce yourself and your interest in our topic today, puppy growth and bone development?
Great. Thanks, Anae. Hello, everyone. Where do I begin? I have been a veterinarian for 30 years this year, and I started in small animal practice, and literally around the mid-2000s, I developed a really strong interest in physiotherapy or in physical rehabilitation. And in 2009, I opened my own practice, and I've been working with dogs and cats ever since. I think one of the biggest problems that we see in practice, certainly where I am, are dogs with hip dysplasia. And that was where my interest really started with regards to puppies and puppy skeletons, because I firmly believe, and there is some of that information now starting to come out, but I firmly believe that if we work on the soft tissue, then we can positively influence the skeleton. And if we have a hip dysplastic dog with an unstable joint and we can strengthen the surrounding musculature, then I think we can make a difference to the development. And so that really was my starting point for being so interested in skeletons. And the more that I read and the more that I research and the more I see younger dogs, and I am seeing more of them, the more I believe we certainly can influence any of the patients that we get. And for those of you that aren't rehab practitioners and are perhaps just very interested dog parents, pet parents, there is so much that we can do both positively and negatively that influences the skeleton. And to have this conversation, really, I think there's so much in it. So thank you to Online Pet Health for choosing to have this as a discussion. I'm really keen to see what transpires for the course of today. So that's me. I mean, I could talk for a long time.
Awesome. All right, so as we get started, let's pull up this image that loves to circulate on social media, and let's break it down a little bit. So Dr. Tanya, can you tell us what we're looking at here and kind of what the misconceptions are and what is really happening?
Yeah, good starting point. So if we start on the left side of the screen at 3 days old, what we're looking at is progressive radiographs of the front limb of a dog. And remember that when we take radiographs, the only thing we see of the skeleton are those parts of the skeleton that have mineralized. So those parts that have got a calcium deposition that then comes up as the white parts that you see on the radiograph, because they will impact those X-rays as they move through, and that's how we get our image. So if you look at the one on the left-hand side, which is 3 days old, what we see is a very small humerus, right sort of in the top third of the screen. We can see a few rib cage, a bit of ribs and the sternum, but I'm more interested in the humerus. Then we can see radius and ulna. So the head of the puppy is towards the left of my screen. I don't know if that's coming up the same for everyone else. But so of the two bones, we know that the way that it's positioned right now, the radius is going to be the one that is cranial, and the ulna is going to be the one that's caudal on this view. Yeah, so that's the ulna, and if you move, that's the radius. And then we kind of like have a gap of nothing where it looks like all we've got is skin and soft tissue. And then we move down and we've got, so that's the skin and soft tissue. And then we move down, and those are the beginning parts of the metatarsals. And if you go a little bit more distal to that, you can see the starts of the phalanges. Okay, so the reason we can't actually see them is because the bone is there and the joint is there. But remember that if we're talking about ossification and endochondral ossification, that means that the bone is growing from a plate which is primarily cartilage. And when the cartilage ossifies, that's when we start to see the bone. So in that whole gap there around the carpal region, we have got a cartilage hub. So a whole amount, and even if you move further up to the elbow area where the humerus meets the radius and ulna, there also we have cartilage from which the bone grows. And if we know how soft cartilage is, I want you to think about how easy it is to adversely impact that soft tissue. Okay, so that's the starting point. If we go to 26 days old, which is then just over 3 weeks, now you can start to see that those end plates, if you move up to the humerus, and we've got that little bit there. So that's the bit that we saw in the first radiograph. And if you move just a bit distal to that right there, that is now the end plate, or that's going to become the humeral condyle. So if I've got the right words, I always get mixed up between condyles and epicondyles. But anyway, and the line between those two is essentially what we end up seeing on the growth plate. So now that whole condyle is starting to ossify. But at 3 days old, it was only cartilage. So if we start to move down towards the carpal region, you can start to see that some of those carpal joints are now also beginning to ossify. And if you move to 49, I think you can appreciate that now 49 days, that's 7 weeks. Now we're almost starting to see the patterns that we're accustomed to seeing on radiographs. And if we go to 62 days, which is 2 months, that looks more like the radiographs we are accustomed to seeing in puppies for most of us, because very few of us will see radiographs of the very young skeleton. And now we can start to see that. Now you see your growth plates, which we're used to seeing, and you can see that all of the bones have started to ossify, and now you can identify those individual bones. But that doesn't mean that they weren't already beginning to form at 3 days old. And for me, this is like the magic when you see them all put together like this and you appreciate what's in those gaps. That's what blows my mind, and what has made me also think, well, how much can we really influence the puppy skeleton? Or the human skeleton, but we're talking dogs.
It is absolutely incredible and mind-blowing. All right, guys, so let's can we look at how these images kind of overlay with the activity level of the puppy? Because a 3-day-old puppy, what is it doing? A 3-day-old puppy.
Yeah, great. So a 3-day-old puppy is really just suckling from its dam. So it's not, I mean, they're only really going to start to move around and weight bear. They start to walk, let's say 2.5 to 3 weeks. So that's going to be 21 days. So when they're suckling at 3 days old, they don't need all of that structure, and it can help you to understand why they perhaps aren't able to weight bear either, because they don't have sufficient ossification and sufficient rigidity within the skeleton to be able to hold themselves up. If we move to 26 days, now we've actually got more calcified bone or more ossification. So we're going to have more rigidity or more support for the muscles. And 26 days is when those puppies are starting to amble around. You know, they're a very, very cute stage. Let's say it's about 4 weeks, not quite. They're starting to move. And at this point, for example, they're still going to be with their mother, and hopefully they're not going to be with any other large dogs, because any other larger dogs or adult dogs, if they stepped on that, there could be a lot of damage done, particularly at wherever that weight bearing may be. Once you get to 7 weeks, 49 days, for a lot of us, I cringe, but a lot of puppies leave their homes at 7 weeks. And now we've got a puppy that is fully weight bearing and fully able to move. It's ambulatory. It's probably starting to try to run a little bit, and it's all uncoordinated because the nervous development still has to happen as well. But if you appreciate from 3 days to 7 weeks, the change in that limb in terms of the support structure. So, you know, that's the development. And then when you get to 2 months, more structure. Now from a neurological and a muscular soft tissue development, that puppy's starting to find its coordination. It's starting to want to play more. It's a lot more active. And it can be because it's got the skeletal support to be able to do that. But that bone at 2 months is still very, very, very soft. Very soft. So it's not completely mineralized at all. And that total mineralization process can take between 18 months and, you know, it's only complete by between 18 months and 22 months, depending on the breed. So although on a radiograph, the growth plates have closed and everything looks complete, we can still, if we're doing a lot of high impact activity from 12 months to 18 months, we can still have a negative impact on the skeleton.
So as you were talking, the connection between the activity level and the bone growth, they really go hand in hand, right? Because bone remodels and shapes and is stimulated to ossify through movement and through activity. So as the puppy starts to move a little bit more, the bones are stimulated and they ossify a little bit more, and they kind of go hand in hand together. Or would the bones ossify even if the puppy wasn't starting to move more and more?
You know, that's a really good question and not something I've ever looked for.
Okay. I don't think necessarily an answer, because
I think there are two components to that. I think the one component is exactly as you said, as they start to move, because everything in our body is a feedback loop. So as they start to move, we are stimulating more bone growth, more ossification. And we know that from a fracture. You know, we just need to see callus formation and how the bone remodels with appropriate weight-bearing exercise. So it makes sense that you say, as these puppies are starting to move and weight bear, the bone's developing. But I also think, and this is just off the top of my head, I would have to research it, but I also think that there is a DNA or a genetic encoding for that to happen as well. So even if the puppy was paralyzed, I mean, swimmer puppies don't necessarily move. Okay, if we talk about swimmer syndrome in puppies, they are, spread eagled, but the bones are still ossifying. So I think that they might not be ossifying correctly, but I think that process that we see here is still happening.
Yeah, I think that's an interesting question, because if we were to take X-rays of the swimmer's puppies, would their bone development be following the same rate, or would there be a difference? Would it suddenly spike when we start to get them straighter and weight bearing?
Yeah.
I don't think this is I don't think it's an either or thing, and I don't think it's a wrong or right thing. I think that, like you said, there are feedback loops, and one thing will depend on the other in feedback, and I love that about the body.
Yeah.
All right, so questions are all welcome. Charlotte asks, so manipulation of the joint, if the puppy is born with a club foot early, it can be manipulated to be normal before ossification takes place? That's an interesting question. What do we do if we have abnormal conformation in a very young puppy?
Yeah, so it's very interesting. I don't have an answer for Charlotte. But I would certainly say I think it can be influenced, but it can be influenced either way. So if I just give you an example, there was some research done in Japan, and I can't remember the author, and I can't remember, it was, I think, in the early 2000s, where they looked at medial patellar luxation. And now we are talking about manipulation, because we know that if the patella doesn't actually sit adequately in the groove, we don't get sufficient development of that trochlear groove or that femoral groove. So what he looked at was he had breeds that were prone to medial patellar luxation, and he actually, I can't remember what technique he used, but at 4 weeks, he already identified which puppies were going to develop medial patellar luxation. And he placed that patella, and then he followed those puppies through. And those puppies ended up with normal development. So in other words, we didn't have to do any further, any sort of surgical interventions on those dogs.
Wow,
So, I could be misquoting him, but I do remember that he started at 4 weeks. I can't remember all of the detail, but he positively influenced the outcome or the presentation of that medial patellar luxation. Therefore, if I had to go and say, well, if it's born with a club foot, can we influence it? Yes, but I think we'd have to understand the biomechanics and what is it that we were doing to influence it. That would be my answer.
I like that. And I mean, 4 weeks is very young, right?
Yep.
We would have to have access to these litters at 4 weeks, which means a very close relationship with the breeders. And I do think there are veterinary habbers who are doing that, who are forming those really close relationships with breeders so that they can do puppy evaluations from a young age. And that's huge. That has huge potential. I love it. How useful would this be to educate breeders for the health of our dogs? I'm a VP and I'm so interested in preventative physiotherapy.
I mean, you answered the question pretty much, Anae, with, if we could get access to these puppies, wouldn't that be wonderful? I mean, I come back to hip dysplasia because I think it's hugely relevant, and it's prevalent. It's prevalent all over the world. And because it's a polygenic condition, we are battling to manage it from a genetic perspective and our breeding stock and the dogs that we're choosing to breed with, because phenotypically they're normal. They don't have HD, but we are still getting hip dysplasia puppies from those crosses. So if we were able to catch those puppies at 12 weeks, how much could we influence them with regards to proper gluteal activation and proper placement of those legs before that instability becomes unmanageable? So I think your question, Charlotte, is very valid. And And I think that the research will come, and the more we have talks like this and the more we question, hopefully the more we can get the funding and the sponsorship to actually do the research.
I agree. And just if we can just start working with breeders, if you can get a few that trust you, that work with you, you're going to learn through that process as well. And you're going to find the areas where we can fill gaps and where we can support them. And I think that's really important. If I think about the horses, I don't know how well this would translate to the dogs, but kinesio tape is incredibly powerful in this young development phase at correcting angular limb deformities. And all you've done is place a strip of kinesio tape in a specific area around the joint. And I think it could be the same thing for dogs if we could apply kinesio tape to tiny puppies. All right, hormones. Katie, that's a great question. So how important are hormones in the bone ossification process? And I think that would go further than just these, 62 days. And what happens with the change when we neuter or spay at 6 months or later?
Yeah, I think it's not an area of expertise for me, but I think personally, hormones are vitally important. And we are seeing some of that research coming out now, particularly with regards to a higher incidence or higher risk for cranial cruciate ligament disease in large breed dogs that are neutered at 6 months versus neutered at 2 years. So there's a big Rottweiler study that came out, I think, last year. And so what we are seeing is that if we neuter dogs at 6 months, then the tibial growth plate closes earlier. The proximal tibial growth plate closes earlier than it would normally, and the distal femoral growth plate doesn't. And that creates a more upright stifle, which then increases the risk of cruciate ligament disease in dogs that are neutered, and that's neutered in terms of male and female, dogs that are sterilized at 6 months of age, because the skeleton is immature.
Yeah, I haven't seen that article, but I have seen the one that Chris Zink and team brought out in 2023, which looked at the differences between sterilization and then vasectomy or ovary sparing spays. I didn't even know we did those. And then intact. And that was one of the things that they brought through, is that, the risk of orthopedic whatever, albertospasia, hip dysplasia, cruciate ligaments, those all increase with early sterilization, which is interesting. But it isn't just, orthopedic conditions that we're looking at. It's cancer, reproductive conditions, there's other health concerns, behavior. Often neutering and spaying is done for behavioral reasons. So Chris Zink and her team looked at all of those different things and their incidents and then tried to pull conclusions from that, which is really interesting. But I mean, I've always been an advocate for, spay and neuter your dog, because we live in South Africa. There are no excuses for having puppies. And I think I might be wrong. I need to readjust that perspective, right? That's what the data says.
I think, perhaps not so much ossification, but just a recap on basic biochemistry is that the structures of the sex hormones are very, very similar to that of cortisone, which is a growth stimulant. So if we don't have testosterone or estrogen or progesterone, then we're not going to get the growth that we need. And if we are removing that source at 6 months of age, then I do think that we are doing our dogs a disservice on every level, not just on the skeletal level, but on the muscular development. It's an androgen. It wasn't corticosteroids. It was androgen was the word I was looking for. It's a growth. It stimulates growth and strength and development. So we sterilize them, we're removing that.
I have to reshift my whole perspective. I've been very judgmental of people that maybe didn't deserve it. All right, so clubfoot in people can be splintered to influence the foot position. Yes, absolutely.
Right.
But then at what age of, at which stage of development does that happen? Does it matter? That would be my kind of question there. And then how do we translate that back towards our puppies? Right, let's see. Okay, this is great. How would you diagnose a potential hip dysplasia so early at 12 weeks old to do preventative physio?
Sure. My favorite topic. So if we backtrack a little, all puppies are born with normal hips. And at 8 weeks of age, we can already start to see some loosening of the capital ligament and a little bit of laxity in the joint capsule. And this then, as the puppies start to walk more and become more active, that laxity is then exacerbated. So, and they're getting heavier. So by 12 weeks, you have slightly more laxity, and don't think in terms of ortolani. It's not that pronounced. By the time you get to a 7-month-old puppy and you've got a positive ortolani, it's quite easy to identify. But I believe we should be palpating hips in dogs, in puppies, when they come in for their vaccinations. And I see there's a question about educating GP vets. Welcome to my world, hey. The puppies just come in and they come out, and I'm not convinced that all of them get the examination they should have because it's time. But we should be evaluating those joints. We should be watching how the puppy moves. We should be looking at conformation. And so whilst you might not pick up an overt instability, I think you would pick up some areas of pain, particularly if you were checking SIJ, if you were checking the muscle structure around there, if you were placing some pressure on the dorsal aspect, so almost on the gluteal area, I think you pick up pain. I don't see enough puppies, and I'm not in GP practice anymore to really be able to comment, and I've tried to get vets on board to do this because, and then we need to be listening to the trainers, the pet parents, all the people that are working with these puppies and going, your puppy's sitting funny. Why is your puppy not as active as I would expect it to be, etc. And we should be, as the veterinary profession, I feel we need to not be as, I've got to be very careful how I say this, but we think that we have all the knowledge. But there is so much knowledge everywhere within our field. And we need to start incorporating that within our practices, whatever it might be, because it is not possible for me as a vet to know everything.
And you won't see everything either, right? There's no way you'll see everything that puppy's presenting. I think you hit the nail on the head by saying, let's involve the trainers in kind of recognizing those signs, because a puppy that doesn't jump is weird. Puppies jump, right? So if it's not jumping, why not? And if they're sitting funny, why are they doing that? So just because I don't think I've ever palpated a puppy, even my own, where I've been able to say, whoa, this is sore, because they're too wiggly. They wriggle and they're like, everything is, I just want to lick you. I'm like, I don't know what you're telling me. But they don't jump if they have hip dysplasia, or not as much as you would expect, right? So I think those are the things, and the trainer will pick up on that. And if the puppy is in like a 6-week socialization class, then educating the owner on those signs can be a part of that class. It should be a part of that class. Is your puppy behaving normally for its breed? What should you be looking for? And if you are seeing these things, what do you do? And I think from a professional's perspective, we shouldn't be dismissive. If someone comes to us and says, hey,
100%.
my puppy's not jumping, but why is it not jumping? And when I say jumping, I mean, you come in the door and they go, hey, mommy, that's normal, right? So I think there's so much scope for us to develop strong teams within different professions, interdisciplinary professions, where we can fill these gaps, create education, and find things like hip dysplasia early. Very, very possible. I think so.
I'd like to add something there, because the question was at 12 weeks. But if the GP vets are seeing this puppy through a series of vaccinations, there's a good chance they're seeing them at 6 or 8 weeks. They're seeing them at 10 to 12 weeks. They're seeing them again at 14 to 16 weeks. And if a joint and skeletal evaluation becomes part of our normal practice, we will start to pick up, oh, normal, 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 normal. Oh, this one feels a little bit strange. And so it's the same as what we do in rehab. You know, in the beginning, it's really perhaps hard for you to figure out. I mean, this is going to sound ridiculous, but I'm not sure I'm feeling a trigger point. And then the more you feel and the more you have a mentor and the more somebody shows you this is a trigger point, the more you go, oh, okay. And eventually you're so blasé about it. It's just, why doesn't everybody know how to palpate a trigger point? And so for me, I think that if vets are able to do that with all the puppies that come through, large breed, small breed, doesn't matter. We will establish what is normal.
I agree. And it doesn't take so much longer to spend 5 minutes, 10 minutes max, just feeling through and doing a quick ortho eval on a puppy. I love that. Yeah. I think in one of Leslie Eads' lectures, she speaks about exactly that and how that process can be incorporated into the puppy early evaluations and assessments. I think that's really important. So let's shift back to cruciate ligaments, because we know that hip dysplasia has a big genetic component. Do we have that same link in cruciate disease, or do we not know yet?
We don't know yet. But there are studies in the process, and some that are, hopefully going to be published soon. But I think they are trying to identify what is with my instinct tells me there's a genetic component, but we don't have the research yet.
Not yet, yeah. No. I think cruciate ruptures are one of the most interesting things to me, because I think there's something we're missing. I think there's a biomechanical link that we're missing because we're not looking for it. But I don't know.
Well, so I mean, if we just backtrack a little, if you think about a steep tibial plateau angle, that will have a genetic component.
Yes.
But if we're talking about degeneration of the cruciate ligament itself, which we think is now beginning to be accepted as the cause, it's a chronic wear and tear degenerative condition as opposed to acutely traumatic, then we don't have the information with regards to genetics pertaining to that.
So what else could be causing that degeneration would be the question. Yeah. All right, let's see. So human HD, and the conclusion was in humans, it's largely due to not enough room in the uterus, thus restricting normal development. Would this relate to dogs too?
From a hip dysplasia perspective, we do know that it's not only the genetics that produces the phenotype or the expression of the genes, it's the environment as well. And so I would also go, yeah, why not? And particularly if you think we're dealing with large breed dogs, which usually have large litters, which means that there's less space in the uterus, then perhaps your reasoning is sound, and it does play a role. I mean, I don't discount anything. I think everything's got to be examined and questioned.
And questions, exactly. I love that. Okay, when I do assessments on dogs with elbow dysplasia, I often find hind limb weakness, maybe possible hip dysplasia. So my thoughts are, if we manage the hip dysplasia early, do you think it will reduce the occurrence of elbow dysplasia? A very interesting question.
I think that it won't reduce the occurrence of elbow dysplasia because that's a separate set of genes. But I do think that it will impact on the intensity of the physical symptoms. Because if we've got a dog with hindquarter weakness, it is by virtue of that weakness weight shifting to the front, which is overloading the elbows. If those elbows have a elbow dysplastic tendency or genetics, it's just going to intensify the problem. But even if that dog didn't have a back limb problem, the elbow dysplasia would still be there. I don't know if I'm really making sense, but I'm just it's got a genetic, elbow dysplasia has a genetic component. It's there or it's not there. Hip dysplasia has a genetic component. It's there or it's not there. And the way that we environmentally impact those dogs will impact the expression of it. but it won't stop it from happening.
But we know how responsive hip dysplasia is to management. Elbow dysplasia, less so. So it makes sense to get ahead of it. Yeah.
Yes, certainly.
So back to the hips. Let's talk about early diagnostics. Tig is asking about the pup scan hip ultrasound done at 8 weeks old. I'm not familiar with that.
Done in South Africa? No.
Okay.
I'm not familiar with it either. So, I've got some research to do after this chat. I'm sorry, Tig, I can't comment.
What about the other diagnostic procedures that we have? So pen hip, that's looking at that distraction index. At what age can we do that? What other tests can we use?
So pen hip has been evaluated and verified for puppies at 16 weeks of age.
Okay.
So in other words, if they take the pen hip radiographs at 16 weeks and they find a distraction index larger than, I don't know, I can't remember the number, 2.5 or whatever, then they have correlated that to severe hip osteoarthritis later in life. In other words, the more we can distract it, which means the more lax the hip, yes, that dog is going to get hip dysplasia later or osteoarthritis of the hip later in life.
Yeah.
But the other, so I think as physios or as people doing rehab, we should be focusing on palpation skills and movement, as opposed to relying on the diagnostics. And if we are lucky enough to be doing puppy evaluations, then if we've got a red flag because now our palpation skills, let's be honest, as a rehabber, your palpation skills are phenomenal. So you are going to pick up something. You are going to then hopefully have a number of vets or a vet on your team that you can say, I'm really worried. Please, can you? So we become, as a vet rehabber, we become the primary, we alert at this point while we continue with the education and the different types of scanning and the different diagnostic or imaging procedures that might be available.
I think that's so important because we can often pick up in the soft tissue that something is wrong long before it's visible on diagnostics. And we need to take that seriously as well, because if we do find something and there isn't a diagnosis that can be made at that point in time, doesn't mean we didn't find something. It just means we found it early. Let's do something about it. And I think that's really important. So thank you for that question with the hip ultrasounds. I haven't heard of it before either. Oh, this is interesting. I've been told that a dog that lies with its hind legs straight out at the back or ceiling has good hips. Is that true or false, or who knows?
So I think you need to look at whether or not the hips are actually extended. So I've seen some of those dogs where the hips are flexed and then from the stifle distally, those are straight. If it's completely flat where it's like I would be lying on our back, or like if you're taking a pelvic radiograph and everything is extended, I would say that your assumption is false, because if we've got enough of an unstable hip and there's no contact, I mean, I've got brachycephalic dogs here with the worst possible hips you can imagine, but there's no contact. And so they've got full extension. In fact, they're hypermobile in those hips because there's no actual hip joint.
Okay, yeah.
So I wouldn't make that assumption.
I also have to say,
I wouldn't make that assumption.
Yeah. Okay, no good. I adopted my GSD at 8 months, and she had been at a shelter so long she was going to be put down. So if I had gotten to her 2 months sooner, I could have done the juvenile surgery. I just knew something was wrong with her, and it took 4 doctor visits palpating her before one finally said, oh yes, we need an x-ray of both hips. They're very bad. That shouldn't have taken 4 visits. Okay, I'm sorry. Yeah, that's really difficult, Rebecca. But hip dysplasia is really responsive to management. It is one of those conditions where we've seen, yes, if you can do the surgery young, great. But if you can't, take a really proactive management approach, diet, exercise, manage pain, And that can be done without non-steroidals for a very long time if you've got all the other pieces in place. So we do, if you need, we do have some resources through Online Pet Health that I can share with you. Let me know and I can send those through to you. Okay. Okay. Is PenHip available in South Africa? Is
No.
it?
So
No.
we have one vet that has done the course. He's in Durban. And the problem is that so everything is patented and all of the radiographs have to be sent to the USA for grading. And it just hasn't been a viable option for South Africa from a cost perspective. That's my understanding.
Okay.
Yeah. And so PenHip is the only distraction process that has been validated to my knowledge. It's not the only one available. So if you go look at hip distraction dogs, you will find that there are a few others. But we don't have any vets at the moment that are actually doing PenHip rads, not in South Africa.
I actually thought Cara Unstutz's webinar this month covers a little bit about the PenHip, and it sounded like you're certified and then you can do the measurements yourself, but you need specific tools or something. So, yep. Okay, interesting.
And then once you've taken the radiographs, they have to go to the United States for grading. So you can't just take them and then grade them yourself. They actually have to go to the States. I mean, it's much easier now than it was 20 years ago because we've got online stuff. 20 years ago, we were physically courier, those X-ray plates. Things have become simpler.
Oh, yes. I think having online resources, whole new world. I love it. Thank you for joining us from the UK. And I'm glad you guys are loving this conversation. It's very interesting. So let's hope that vets can start to do muscle and bone assessments early on in the puppy's life. Yes. Are there any resources for routine stretching, massaging, and movement exercises that can be done by the puppy owners to reduce risks? Or would this not be recommended? What are your thoughts on that and what puppy owners should be doing and shouldn't be doing with their puppies? I think this is a huge question because how much activity is too much in a growing puppy? How do they know? How do they regulate that? What kind of training or exercises should or shouldn't puppy owners be doing? I think this is a massive topic. Can you speak into that a little bit?
Sure. I mean, I have a whole course on managing puppy hip dysplasia. And from if you're the breeder, right the way through to the first sort of, I think it's 4 months of age. So I've got a lot to say. So let me summarize what I can. First of all, I think it's vitally important that we appreciate, we come back to the beginning of this talk, and if you weren't here, how soft that skeleton is. And so one of the big components of a dog that brings on the development of hip dysplasia, aside from the genetics, environmentally, is trauma. So if we've got pups that are running and jumping and slipping on floors and tumbling, and they're playing with dogs that are bigger than themselves and that are older and more developed, remember that your 12-week-old puppy is still clumsy. Now it's going to play with a 6-month-old or a 1-year-old who is way more physically capable. They're going to try and do the same things that those dogs are doing, and they're not going to be able to because they don't have the neurological development, they don't have the cohort, they don't have the muscular support, and they're going to fall and they're going to tumble. And the more that happens, the greater the possibility that the hip dysplasia that is underlying in that dog will develop. So we need to really be speaking to our puppy parents to say, you've really got to manage this puppy, and you've got to manage its haji-baji with bigger dogs. One of the things I'm adamant about is no stairs until 12 weeks. Pups do not have the neurological development to manage stairs until they're 12 weeks old. So we've all seen those videos on Facebook of the dogs tumbling down the stairs. And I cringe because all of those joints, that soft skeleton, is being bumped and traumatized every single tumble. And so we can be telling clients this, so block off the stairs until the puppy is 12 weeks old. When it gets to 12 weeks, put it in a harness and teach it to walk up the stairs and teach it to walk down the stairs. And in the long term, if that dog understands that it's got to walk up the stairs instead of hurtle up and hurtle down, you are setting that dog up for longevity, a good life, good quality of life, success. So that, I'm sorry, I got on my soapbox a little there, but it's things that we don't, I mean, as vets, we certainly don't talk about it. So environmental control and control of movement is important in terms of excess movements. I mean, certainly no endurance. So no running on the road, no long walks, because even the long walks are going to pound those joints. We rather work with the neurological development in puppies is huge until 4 to 5 months. So we want to rather, and the skeleton is left behind. The skeleton in the body is left behind. It's growing quickly, but it can't cope. So in up to 4 or 5 months of age, we should be focusing on mental stimulation, on socialization, on exposing those puppies to as much as they can in a controlled way. And in there, we should be doing what I call foundation exercises, and those are body and hind limb awareness. So if you give your puppy or your puppy parents the ability to teach hind limb awareness and body awareness by 6 months of age, you will, in my opinion, seriously reduce the manifestation of these genetic disorders.
I like that. And as you said with the stairs, it's really just about not doing the things that are going to increase that risk so dramatically. Charlotte is saying slippery floors. These very funny videos that people like to share all over social media where the dogs are just slipping all over the place. I don't, how are we so blind? But okay, no soapboxing. Tanya, you presented a webinar for us on this exact topic, the puppy development, didn't you?
Yes.
Yes, it's in our membership. It's in our membership, and it was fantastic. And it goes through the neurological development and the exercises, and everything is in there. So I will link that as well when we're done. And then if you guys are looking for a resource, very simple, that you can share with owners to help educate them, we've created a puppy exercise guideline PDF from a vet rehabber's perspective, which really just highlights the different variables. So if this puppy is a large breed puppy and it's at an increased risk for hip dysplasia or elbow dysplasia, then avoid these things or do more of these things. It will just help you educate owners and give you a starting place to have a conversation from. So every dog is an individual. Have that conversation, educate them, and then have that conversation about what their dog needs and what their risk factors are. And I'll share that with you as well, because that one is free. So I'm going to cut us off here because we've hit 50 minutes. Guys, it's been so great to have you all live with us. Tanya, thank you for sharing your knowledge and just being willing to come online with me, have a conversation, and chat with all of our vet rehabbers.
It's a great pleasure, and thanks for all the questions and the responses and the comments. I really thrive on all of this kind of interaction. So yeah, thanks for having me.
Awesome. Have a great day, everyone.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Curacor. Their sponsorship allows us to be able to give this podcast to you for free. So please go and check them out at curacor.org. Don't forget to bookmark the next Vet Rehab Summit. It's on Saturday, the 31st of August, 2024. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.